So just to give a bit of a background on who we are and what RoadSafetyBC is, RoadSafetyBC was previously known as the Office of the Superintendent of Motor Vehicles. It is the lead provincial agency responsible for road safety in BC, and it is part of the Ministry of Public Safety and Solicitor General. The Superintendent of Motor Vehicles is the head of RoadSafetyBC, and there are several programs that RoadSafetyBC has to accomplish road safety mandates. And one of these, of course, is the Driver Medical Fitness Program. I would like to note here that RoadSafetyBC is not ICBC. ICBC is a stakeholder of ours that we do work closely with, obviously with licensing. However, we are not ICBC. They are a separate entity from us. The Driver Medical Fitness Program is made up of a group of adjudicators, 5 of whom are registered nurses, and we take medical information and we adjudicate information to determine driver fitness by using the 2016 CCMTA Medical Standards for Drivers with some BC-specific guidelines. CCMTA is quite a mouthful, but it actually stands for Canadian Council of Motor Transport Administrators. Miriam has, I believe, provided you a link for that, and you can also direct link if you have this in a slideshow mode, this presentation. So the CCMTA guideline is available on the website at RoadSafetyBC, and there's lots of other useful information there as well. We also use administrative fairness principles and case law. We also must have evidence of a public safety risk and current medical information. And then we look at these based on the risk and which ones we might look at first, but that just depends. When does a driver get a driver medical examination report? In most cases, you will receive a driver medical examination report when RoadSafetyBC receives an unsolicited report of concern from a medical professional. Unsolicited means we didn't ask for it. You'll get one when Road Safety receives a credible report of concern from police, a family member, or the public. You might disclose that you have a medical condition when you're at an ICBC driver licensing office, for example, when you're renewing your license. You may receive one at a scheduled reassessment interval, which is when you have maybe a known condition, and we might be following you a yearly or every 5 years. When you turn 80 and every 2 years thereafter, or if you have a commercial class license and there's routine commercial class screening that happens. The next slide actually shows you what the driver medical examination reports look like. I realize they're quite small here, but you can access these on our website. And there are 2 types. You can see that there's a blue form, which is used for people who have a known or suspected medical condition, and the yellow form is used for people who are 80 or over or have a commercial class license and having regular checkups. The other document we have, which is really difficult to see here, and Miriam has provided the flowchart over as a file that you can upload or you can get on our website. And this provides a general overview of the processes involved to determine fitness. It sort of gives you how the flow would happen and what would happen if you're found fit or unfit or need further assessment. More specifically though, to get into how we make our decisions, and keep in mind we will get back to how this relates to having Parkinson's, is that we have to make our driver medical fitness decisions based on information from healthcare professionals, and that is mandatory. We will use information from other sources. We must use the 2016 BC guide to help us determine fitness. And we must use administrative law principles to guide us as well. And this next slide is about the specifics. And this is, meant more for your doctor or your nurse practitioner who's filling out the form. But this is a portion of the form of the driver medical examination report that would be completed by your doctor. And to break it down, what we're looking for in terms of driving is motor abilities. And that means how well your body is able to move, meaning how well your arms or your legs or your trunk of your body, your neck are moving, as well as your strength, your reaction time of all your body and your limbs. The other aspect is also cognitive abilities, which means how your brain is able to manage your activities of daily living, your reaction time to stimulus, things that are happening around you, your decision-making skills, the sequencing of your actions that you do with your mind and your body, and this also includes some memory and your judgment as well. We also look at sensory abilities, which means your vision, your proprioception, which means your body's ability to feel objects and pressure and react. So example, like your foot on a gas pedal or the brake. And also being aware of where your body is in space. We take into consideration how all of these are working individually and also how they might be working all together. And this information we try and gather from the physician and through other sources. When we do receive the evidence, the adjudicators will have a look at what we've received, and we might have to ask for further medical information if it's not enough. We might ask for a functional driving evaluation, which can be a drive-able assessment, an ICBC road test re-exam, or we might have an occupational therapist who specializes in driving evaluations do an assessment. The other thing we might do is cancel your driver's license, or we might find you medically fit to drive. Now, specifically in terms of Parkinson's disease or other neurological conditions, you may already be aware that all three of the systems that I mentioned before, your motor, cognitive, or sensory systems, can be affected at varying times, sometimes more prominent than others, and it can be variable. This depending on where you are in the stage of your condition, what treatment you may be receiving, how you're sleeping, or maybe other medical conditions that you may have. These all play a part in determining how you might perform behind the wheel of a vehicle. Your doctor or other health professional will provide RoadSafetyBC with information about all of the areas that can affect driving. But sometimes they don't always provide us with a clear enough picture, or they don't fully know how your medical condition will affect you while you're behind the wheel of a car. So that's when we may ask for more medical information, or we may require you to complete a functional assessment of your driving. For example, as it stated here, the drive-able assessment, which is more focused on cognition, And that is looking at how your brain is able to manage the activities of driving. And this is done in a specialized vehicle, so you don't do it in your own car, and it does have a computer test component. This is available on our website about the Drive-Able assessment. ICBC road tests are done in your own vehicle, and they're the standard road tests that all of us have gone through at one point in our lives, and that's just to see how you're doing with the rules of the road and managing your vehicle. And then of course there's the occupational therapist that can do a driving assessment. Of course, unfortunately, sometimes a person's medical condition can get to the point where things aren't going as well and a cancellation of the license is recommended. And this information we don't take lightly, for sure, and we must have reasonably reliable evidence of a medical issue and reasonably reliable evidence of a road safety risk. If your driver's license is cancelled, you will be notified by a letter and you will be given an opportunity to respond, as you may disagree with this decision, or you may have had improvement in your medical condition that you want us to know about. When your license is cancelled, you are always given a remedy. And that means the information that you will need to provide to RoadSafetyBC to have the decision to cancel your driver's license reviewed. In general, this is an improvement in your condition, supported from your physician or medical practitioner. You may then be required to complete a functional assessment like an ICBC road test or Drive-Able or the other with the occupational therapist. We also apply administrative law principles to all driver medical fitness determinations. And this means that a person affected by our decision has the right to know what information was considered in making the decision and be also given the opportunity to respond to it. So that's why our letters are quite thorough in providing the evidence that we used to cancel your license, and may come across as a bit too much detail, but that's because you have the right to know why we canceled your license. Now, there's lots of questions, I understand, and that concludes the slideshow portion, and we're now open to any questions you may have. We'll start with the original questions that I had back in slide 2. Just going to go back there. There. And then we'll have a look at the other questions that have come up since then. The first question, I have Parkinson's disease. Do I have to stop driving? No, not necessarily. But for the reasons that I mentioned in the PowerPoint, it does depend on how your body systems are all working and the stability of your condition. So if you have Parkinson's disease, you can still certainly drive as long as you have the support from your physician and or you've had an assessment of your abilities and you can drive. Number 2, what is the process once I have disclosed to ICBC about my diagnosis? Well, if you have gone into ICBC and you've disclosed that you have Parkinson's disease or other medical condition, they will issue you a driver's medical examination report. You'll take that to your doctor and or nurse practitioner, and they will fill it out for you and send it in to RoadSafetyBC, which we'll review in sequence or by terms of risk. Number 3, if I am deemed unfit for driving, is there an appeal process? Yes, as I mentioned, when you are deemed unfit for driving and we cancel your license, we do send you a letter outlining the reasons for the cancellation, and you have the opportunity to respond. Number 4, how long do I have before my license is canceled once deemed unfit? When the letter goes out to you canceling your license, you have 14 days before it is fully canceled. However, it is recommended that you stop driving once you receive the letter. Number 5, if deemed fit to drive, how long do I have until I need to renew my license again? Well, if you have been found fit to drive and you've gone and got a new license, you have 2 years before you have to renew again. Number 6, what forms do I bring to my doctor? When you go to see your doctor, if you've been given a driver's medical examination report form, then you would take that to your doctor, and it would be important that if you have any other information from other health professionals that you've seen, to bring that with you. Hopefully your doctor has all that information, but you would want to make sure that they have everything they need. Number 7, what are the driver fitness guidelines? It's a very large document, but it is the CCMTA guide that we have available for you to review. And it's broken down into the various areas of medical conditions that you may have. So that closes on those.
Assessment if we've requested it. So just to be clear, the test, if you're referring to the driver's medical examination report, if we've issued that report to somebody because they have a known or suspected condition, in this instance, sorry, can you hear me? I'm a bit far away. Marianne, perhaps you can just tell me if I'm loud and clear. Perfect. So if we issue a driver's medical examination report because you've disclosed your condition, or if we're following up from a previous medical where we were made aware that you had a condition, then RoadSafetyBC pays $75 towards the cost of that examination. Physicians may well charge more than that. We can't dictate what fees physicians charge, but here in BC, unlike in other jurisdictions, we do pay $75 towards the cost of those medical examinations. If we determine that it's necessary to see how you're able to compensate or overcome any deficits that you may have functionally, and we need you to go do a road test or a functional driving evaluation of some sort, then we pay for those as well, full cost.
Thanks, Kevin. Miriam's written in here, where do I go to disclose my condition to ICBC? You would attend any ICBC driver licensing office in your community, or a service DC provider, and you can tell them in person. And I believe you could phone RoadSafetyBC and ask us what to do as well if you were wondering. Next question, how might my healthcare professional, GP, neurologist, etc., work with me to disclose and get tested? Yes, it's very important to have that discussion with your healthcare professional, and particularly your neurologist, because they'll help you figure out what may be the problems you might be having that could affect driving. A physician can tell you not to drive, and it is expected that you would adhere to that medical advice. Your physician would not have to inform us. Your physician would not have to inform us of your condition as long as you adhere to their medical advice not to drive, or not to drive until you've become more stable, or your medications are sorted out, or you have a treatment. So, but in saying that, it's good to have the discussion, and they can always phone us as well to speak to a nurse case manager there's a dedicated medical professional line, and send information in. Okay. Next question.
The MOCA or mini mental status exam affect the decision to pull a license. Those are screening tools, and they're used in the context of all the other information that we may have on file for somebody. We don't, screening tools in isolation of any other information aren't that useful to us. So hopefully when we get screening tool scores, they're provided in the context of additional collateral information. But screening scores in and of themselves or by themselves, those are not all that useful to us.
Report from a family member look like? Well, a credible report means that the person has given their full name, their full address, and a phone number to contact. It means that we do not accept anonymous reports, and that's what credible means in this case. The information in it we would have to obviously weigh, but and we don't know whether or not that part is credible, but the person has to not be anonymous, and that information we take very carefully and would want confirmation from a physician or medical professional before making any decisions. What about timelines from Judy? What about timelines from sending a medical into RoadSafetyBC and finally getting a letter back to you? We give 45 days for a driver's medical report form to be submitted to RoadSafetyBC from the time you receive it. And then it depends on where your file is in the system that when we will get back to you.
We do have some volume challenges here. We have an exceptional amount of volume of cases that we have, so we're not as quick as we'd like to be in terms of turning files around. We do the best that we can.
Yes. And I should make a point that you can always phone RoadSafetyBC and tell them if you're having trouble getting in to see your doctor or needing it just a tad bit more time to get it in. And we're quite good with giving brief extensions. Approximately how often are people with Parkinson's prevented from driving?
I'm afraid we just don't keep that kind of data. I mean, the reality is that all of us, those without Parkinson's included, will outlive our ability to safely drive. In terms of absolute numbers of the frequency in which folks who are experiencing Parkinson's are needing to give up their license, I'm sorry, I just don't have an answer for that.
A driver simulator to use on the internet. I'm not aware of anything. There might be things out there that you could use to try and work on your reaction time and skills. You'd be welcome to do any of that. The information that we will review, though, must be from a medical professional. Yes, if you disclose that you have a medical condition, particularly Parkinson's disease, they will definitely issue a driver's medical report form. ICBC has a operations manual that they follow, and so everybody is asked that question when you renew if you have a medical condition. And there's certain conditions that they won't issue for, but definitely for Parkinson's disease. And you were going to say something, Kevin?
Oh, just that if it's already known to RoadSafetyBC that if we're already aware of a person's condition and you happen to go in and disclose during a renewal, let's say you're renewing your license ICBC. If we saw you a year ago, or you were previously issued a driver's medical examination report, it's likely that you wouldn't get another one at that point. But I guess the basic answer to your question is certainly if we're not aware of your condition and you disclose that you have Parkinson's disease or other conditions that are on the master list that ICBC has, then yes, you'll be issued a driver's medical examination report for completion. Requests would go through a Freedom of Information request, and for good reason, any information that identifies the person who made the report, that would be severed from that request.
So you can try contacting the Freedom of Information.
No, they would just go through us if they wanted to.
If they, okay, and then through RoadSafetyBC,
Yeah.
and then they decide though what portions of the report you can see, and generally you won't find out who.
No, we redact information like that for good reason. But just to be clear, we don't act on reports that are submitted in a malicious way. Obviously, the intent of our office is to ensure that everybody's safe to drive, and we allow them to drive as long as is possible. And when we receive reports such as that, we're acting on them not because there was any malicious intent behind the person submitting the report, but legitimate concerns about whomever they were reporting.
Which is why then we ask for information from your doctor to confirm whether or not there is a problem.
Yes.
Let's say tomorrow, you would be expected to tell ICBC that you have Parkinson's disease. Otherwise, you should be going by the direction of your practitioner, that's your treating physician or other practitioners involved in your treatment. They should be actually directing you as to when you should and shouldn't be driving, and that's the advice that you need to adhere to. You don't have to go to ICBC to tell them. It's a matter of adhering to the medical advice and or upon renewal.
You're either operating your vehicle and you're fully licensed, or you're not. So if you're fully licensed, your premiums don't change. This is separate and away from insurance premiums. The only instance that there might be an effect on your insurance would be if you drove against medical advice, or if you continue to drive after your license had been medically canceled. Aside from that, though, there's no effect on your premiums. If you're licensed, you're fully licensed and good to go.
Yeah. Patricia, when a driver with Parkinson's disease, I'm not aware of any specific case law, but what we could say is that if there's evidence that your physician has told you not to drive because of your medical condition, and you do so against that advice, and you were to get into an accident, that if it went to court, that could be used against you. And obviously, if you were canceled for your medical condition and you drove while canceled, that also could be used against you in a court of law. That's probably the best way.
So much for all of those questions, and I know that there are probably a lot more that haven't been asked and would like to be answered. So if that is the case, please do submit them to me, and I'll do my best to relay the information to RoadSafetyBC, and hopefully they'll be able to get back to us. We are just approaching the end of the time, so I wanted to make sure that folks could download the files or access the links that are on the chat, because I know that this is important information that people are really interested in receiving. If you can't for whatever reason, please just email me, and I'll write down my email here so that you I can send it to you. Oops. And you can look over it. I just wanted to take a few minutes to thank Catherine and Kevin for really kind of diving in and getting specific with us, because I know that for a lot of chronic diseases, it can vary depending on what that disease looks like and how it manifests. And so having you answer specific questions around PD is really helpful for us. So thank you. And also thank you for just kind of guiding us through that process and assessment procedures that are, some of the back end kind of the quote unquote hidden things that we may not be aware of if we're not thinking about, or if we haven't thought about having to renew our license, or even getting or having a conversation with our healthcare professional about our driving ability. So thank you so much.